Are you looking for pieces of information on cystic fibrosis? You are in the right place. Without further ado, let's go. Hi everyone, I want to talk about cystic fibrosis. That is not a new subject, right? Yeah, you're familiar with cystic fibrosis? Well, I feel for everyone that is affected, it is a genetic trouble. So it is not the fault of all the affected people. They actually inherited that, and unfortunately from both parents. By the time we go through how it is inherited, and we'll also go through the pathophysiology of the clinical presentations that we're going to see in anyone with cystic fibrosis. And of course, once we know how we got there, we might be able to know how to help these affected individuals. So with that in mind, please sit back, relax, and go with me. Let's go. Cystic fibrosis in the olden days will kill people pretty fast. Now, with modern medicine, the average lifespan is 38 years. Actually, it's more than that in some other parts of the world where people could get standardized healthcare services and that will not affect their wallet or is even free. So, average age, mean the lifespan, if anyone is diagnosed with cystic fibrosis, is at 8 years. There could be more than that in some parts of the world, in more advanced centers. The problem here is that the affected individual can't handle sodium chloride. They can't handle sodium chloride, so they have sticky and thick mucus. And cystic fibrosis is also called fibrocystic disease of the pancreas. Actually, that serves the origin of the name of the disease, how it was initially come across, like cystic lesions in the pancreas. Okay, so formerly called fibrocystic disease of the pancreas. It affects the lungs, the pancreas, leading to diabetes mellitus type 1, decrease in growth, blocking the tubes, causing infertility, and so on. Don't worry, we'll go into clinical features soon. It's a genetic problem, like I've alluded to at the beginning in the introductory part. It's a genetic problem. And how it could be inherited, we'll get to that in a bit. However, regardless of all the troubles, the brain of affected people with cystic fibrosis is intact. The brain is not affected, so don't mess with them. They're pretty smart. The clinical features, yeah, this is where we're going. Cystic fibrosis patients are low in sodium chloride. Why? Because it is lost in skin. So they have hyponatremia, and hyponatremia will have cascade of symptoms and signs: confusion, decreased level of consciousness, and so on. They are often dehydrated because the sodium that should retain fluid is lost in sweat. So they are often dehydrated. The mucus that is sticky and thick will allow bacterial growth. That is why most of the patients diagnosed with cystic fibrosis are on antibiotics for a long period of time, or they are on and off, on and off. They take broad spectrum antibiotics. Why? The mucus will allow bacterial growth. There's wheezing in them, like you find in asthmatic patients. No wonder. It is said that not everything that wheezes is asthma. There's asthma who wheeze. Of course, I don't want to go into details of that because sometimes we have what is called silent asthma. That is not to say the individual is fine. It's actually what when you have silent chest in acute asthmatic condition, but we're not going into that now. Okay, it affects sinuses, could affect the gallbladder, blocking that and forming stone because the bile duct is blocked. In the newborn, we are going to find meconium ileus, and they could even be constipated. In the lungs, patients with cystic fibrosis will have chronic obstructive pulmonary disease by emphysema. Can have hyperinflation with air trapping, and of course, they can have hemoptysis, and they would likely develop what is called carpulmonary. That is, the right heart is failing because there's trouble in the lungs. So, you're going to find the features of right heart failure in someone having respiratory problem. That is called pulmonary. The sticky mucus is a nidus for Staphylococcus aureus and Pseudomonas. That's why most of the times we give patients with cystic fibrosis tazocine, that is tazobactam with piperacillin. I'm not selling any medication here. I'm only telling you what I know is good for them. So they have recurrent pneumonia because the Staphylococcus aureus and Pseudomonas are just thriving. And they are not the only two organisms. You can find in them a whole lot. Upper respiratory tract infection is not spared. They could be snoring because there are a lot of sinuses that are blocked. In fact, there will be sinusitis as well. In the pancreas, when the exocrine duct is blocked, there will be staturia because there is indigestion and the stools will be foul smelling. In the liver, it can cause cholelithiasis, okay? And in the intestine, they call ileus, constipation, and as a matter of fact, they could have intestinal obstruction. In fallopian tubes, they block that. And you know the implication of that? The egg release from the ovary will not be able to flow to meet the spermatozoa coming from down, and then no fertilization, and of course we are dealing with infertility, okay? That is in females. But vas deferens is blocked in males, and you know the implication of that? Azoospermia. As far as the skin is concerned, they're going to lose sodium. Therefore, when a cystic fibrosis patient is sweating, they need additional salt. Still on clinical features, there could be rectal prolapse. As a matter of fact, that is one of the history questions that we're going to take when trying to take history from anyone that we are suspecting cystic fibrosis. Rectal prolapse. There's going to be electrolyte imbalance if you acid the electrolytes, and of course, small bowel absorption. I've just explained that. Dying young is going to be secondary to pneumonia. Okay, how did we get here? The hereditary nature of cystic fibrosis, and here is the story. It is more common in males than females. And the problem here is with cystic fibrosis transmembranous conductancy regulator. That is where the anomalies are found. when CFTCR is not normal, then that's when we have all this problem. And that problem is inherited genetically as autosomal recessive condition. In other words, in autosomal recessive inheritance, the parents are healthy, but they are carriers. Did you hear that? And Mendelian inheritance pattern, kudos to Gregor Mendel, has given us the probability that when two carriers, carrier father and carrier mother, who are phenotypically or physically healthy, they are not having cystic fibrosis. They are physically healthy, but they have heterozygous condition in them genotypically. So they carry the recessive gene for cystic fibrosis. Now, for cystic fibrosis transmembranous conductance regulator, right? The probability of the offspring they're going to produce to come out as having homozygous recessive genes that will give cystic fibrosis is 25% of each pregnancy. Not saying when they have 4 children, then one of them must have cystic fibrosis. No, it's not a game of, I don't know, it's not a fixed game, it's a game of probability. They can have 2 kids and they will be normal. They can have 3 kids, they will be normal. They can have 4 kids and some will be carriers and the rest will be normal. But unfortunately, they can have only 1 child and that child could have cystic fibrosis. It's just 25% probability of each pregnancy that the wife will carry as far as their relationship will continue. This is very common among wives of Northern European descent, but we should not be fooled, it is worldwide, but common among wives of Northern European descent. Just as we have sickle cell disease common among blacks, thalassemia amongst Mediterraneans. This is the Northern European descent problem, mostly, but it could be found worldwide. People now intermarry everywhere. Infertility, yes, because we have to talk about it because this is giving a lot of people with cystic fibrosis a lot of headache. No, they didn't cause this. They didn't make this. No, it has just happened to them, and they want to live their own lives. They want to, reproduce. They want to marry. They're normal human beings, except for this genetic problem. More males are infertile. Greater than 90% of them will be infertile. Less females are infertile, less than 40% of them, and there could be delayed puberty. Yes, pathophysiology. How do we get here? Well, the exocrine glands secrete and use DOS to get the content to wherever it is going to be used in the body. Cystic fibrosis transmembranous conductance regulator is needed for the exocrine glands to function well to control in and out of sodium and water. That same CFTCR is not working well in cystic fibrosis. So secretions are not thin, but thick. They cannot handle sodium. So the mucus is thick and sticky. Thick mucus blocks tubes and passages for many exocrine enzymes. Therefore, we have cetrostudia in pancreas, cholelithiasis in liver, meconium hilus in intestine. The sticky mucus is also a nidus for Staph aureus, Pseudomonas, and so on. at birth. If you find that the child has meconium with respiratory problems, because there's possibility of meconium aspiration syndrome, then rule out cystic fibrosis, particularly if the child has been delivered to parents who are from Northern Europe. Begin to think along that line. Cystic fibrosis diagnosis by newborn screening is good before the age of 2 years. Why that? You will start early to be helping them out. You can make your own diagnosis in a more comfortable way by testing the sweat from your own child. After all, it's your own, so you can taste the sweat from your child, right? If it is salty, then there is likelihood that we are in a big trouble with cystic fibrosis. If there's positive family history, if from the common race, there is likely going to be failure to thrive because there will be low fat absorption. Remember, the pancreas is in trouble. There will be decreased weight and, of course, recurrent pneumonia. Diagnosis: chloride sweat test. You can use pilocarpine to stimulate the skin to produce the sweat. Then, when you check, if it is less than 40 millimoles per liter, that is normal. But anything greater than 60 millimoles per liter is strongly suggestive at first time. But we cannot make diagnosis with just one test. Then we're going to repeat the sweat chloride test again the second time. If by the second time the value is greater than 60 millimoles per liter, it is highly suggestive and almost diagnostic, but not confirmed yet. You cannot yet label that child and then make him or her sad and the parents sad. No. The next thing is to do genetic testing to establish CF, TCR anomalies. And once that is confirmed at that level, then you can place delivery and then start working on how to help the affected child. What are the possible differential diagnoses of cystic fibrosis? So if you have taken the sweat chloride test or you've seen clinical features but not genetic screening yet, and the parents are freaking out, then you can say, oh, okay, hold on. The chloride test is pointing to positive side, but there are some other conditions where we could find that. Anorexia nervosa, nephrogenic diabetes insipidus, particularly someone on lithium, right? Hypogammaglobulinemia will increase chloride and give a false positive result. Adrenal insufficiency will give us the same. Go to find out in hypothyroidism. Atopic dermatitis, you got it from the skin, right? Of course, Klinefelter syndrome. So with that, the parents will be calm until you have the genetic screening done. So high chloride sweat test is not only in cystic fibrosis. You can pause and see all these differential diagnoses. Okay, atypical cystic fibrosis. In atypical cystic fibrosis, it means you're not going to find all this stuff that I've been talking about since just like that. It's not according to the books, or you understand what I'm saying? So it'll be normal or abnormal sweat chloride may be present. The pancreatic function might be very good. They can have chronic sinusitis and azoospermia just like the typical cystic fibrosis patient, with or without lung obstruction. So, We are not saying lung obstruction, they cannot breathe, but they are not having recurrent pneumonia. How about that? I won't waste your time. We can pause and go through that. So that is fine, right? If I'm going to choose cystic fibrosis for myself, I would rather choose this. Treatment. How do we treat? Well, there's no cure, but we can help in many ways. For a good relief, we can do chest physiotherapy twice weekly, once before breakfast and 2 hours after supper. We can treat supportive treatment all the time using bronchodilators to expand the region so that the secretion will be able to flow. Pancreatic enzymes before meals because they need that for digestion. Antibiotics because the sticky mucus serving as needles, a lot of bacteria there, then we give broad-spectrum antibiotics. Mucolytics to thin up that thick mucus. Vaccination against flu and pneumococcal, yes, we have to take them for flu, just like we take sickle cell disease kits for pneumococcal vaccination and flu vaccination as well. Laxatives, because of possible complication of constipation. We are going to treat diabetes mellitus, and it's going to be type 1 here. Still on treatment. It's generally not the job of one department. It is multidisciplinary in approach, involving respiratory therapists, pulmonologists, endocrinologists, because I've talked about pancreas being in trouble, now about talking about diabetes mellitus, and gastroenterologists, because we talked about possible constipation and intestinal ileus. Reproductive specialists talked about fallopian tube blockage, vas deferens blockage, azoospermia, infertility. This egg would not be able to flow to reach the sperm for fertilization, and so on. And of course, psychologists, because how would they not be depressed? And how about the good parents? The good parents who didn't know that they were carrying these genes, and they fell in love, they married. Now, the first child, probably the second child, also both now having this trouble. So we need psychologists here who will be able to calm everybody down. Family counseling for the same purpose. And we have to do one thing. We keep working. If we are lucky, if we get it done, that is lung transplantation. Keep working towards that. In conclusion, please find out about Cystic Fibrosis Association in your region. That's going to help with lots of pieces of information, new innovations in health field. As per cystic fibrosis, you get that, and even funding, and for support, moral support, and so on. Eat well and enjoy your life as long as you have the opportunity to. Wishing you and all the caregivers and family members well. Thank you. Thank you for listening to my presentation. Kindly subscribe so that once I publish these presentations, you'll be able to have a copy immediately. I appreciate it. Thank you.